Anindita. She is a high school senior, sitting just 11 months away from the finality of university applications. If you ask her what her plan is, she will give you a highly specific, unwavering answer. She intends to become a doctor. But if you ask her why she wants to study medicine, the data reveals a different layer. Her primary motivation is that her parents suggested it. Building a long-term academic trajectory heavily on family expectation, rather than a baseline of personal curiosity, carries a specific kind of risk. It removes the internal engine a student needs to survive a highly demanding academic path. When we encounter a major life goal driven primarily by external pressure, our objective is never to shut the idea down. Instead, it is a clear signal to look closer at the profile, pause, and open a conversation. We start by auditing the quality of her stated aspiration against her tangible actions. If a student genuinely wants to be a doctor, we typically see a trail of primary research. But Anindita hasn't shadowed a physician. She hasn't attended medical webinars or read up on clinical practice. Her aspiration exists almost entirely in theory. Then we look at her achievement data. Overall, she has a very solid academic track record, holding an 80% average. This chart shows how her average breaks down. Her highest marks cluster in arts and languages, but notice the drop in biology, the core science of medical training. Her strengths point one direction, while her chosen path demands mastery where she struggles most. These contradictions tell us that she is attempting to commit to one of the most rigorous academic paths available, without having full information about the field, and without her proven strengths aligning with the requirements. To understand why this disconnect exists, we have to look beneath her surface grades, examining the deeper layers of her psychological potential and cognitive aptitude. Her interest profile points strongly toward creative expression and nurturing roles. While nurturing aligns with caring professions, it maps closer to counseling or artistic therapy than to clinical science. This radar chart compares Anindita's cognitive results against medical school requirements. Overlaying them reveals a geometric gap. Her numerical and abstract reasoning sit near average. Medical schools require exceptionally high metrics here. The path would demand disproportionately massive effort and strain compared to peers. That brings us to the final and most sensitive elements of her profile, her current situation. Her mental health screening shows elevated indicators in anxiety and depression dimensions. While not clinical diagnoses, they signal she's navigating immense inner emotional pressure. When we factor in that psychological strain, our immediate priority shifts. The question is no longer which major is the right fit. The question becomes, is she emotionally ready, right now, to make a major life decision under this much weight? Let's bring all the data points together. We have an underinformed aspiration, academic achievements pointing elsewhere, cognitive potential sitting below typical medical thresholds, and a high-strain emotional situation. When these four elements fail to perfectly interlock, the result is not a failure, it is not a final verdict, and it is absolutely not a reason to tell a student no. It is an invitation. For Anindita, the recommended next step is a gentle, non-judgmental follow-up session. We aren't here to blame the parents for wanting a stable, prestigious career for their child, and Anindita is certainly not wrong for wanting to honor her family's expectations. Our objective is to give her the concrete information and the psychological space she needs to achieve autonomy. Even if she reviews the reality of the medical path and still chooses it, she will be making that choice freely, as herself. When we present difficult, misaligned data with empathy, we remove the need for defensiveness. We transform a potential point of conflict into a conversation that opens doors.